Hello, I'm Jude Cornelson from the Department of Family Practice at UBC and delighted to be presenting on the Rural Community Resilience Project along with our project team, Eric Hunter, Sohem Darji, and Claire Steiff. We're going to be talking about a project we did, which was administering a survey on rural resilience across the province funded by the BC Support Unit. I would like to, first of all, acknowledge that I'm coming in from the Coast Salish Tsawat Nation with gratitude on, their unceded ancestral and traditional territory, and acknowledge all of the traditional territories across the province belonging to the Métis, First Nations, and Inuit people. So a little bit of background to the current study. We had a project going called the Rural Evidence Review, funded by the SPORE Support Unit, and this entailed us engaging with rural communities across the province to understand their health service priorities. We did this through outreach efforts, through a citizen panel, through surveys, and lots of focus groups and discussions, and we took what we heard and translated the priorities into systematic and scoping reviews to understand the issues more thoroughly. This occurred during the initial phases of COVID-19, and one of the requests from communities was to understand a little bit more how other rural communities were responding to COVID-19. So we did this through survey research, had a great response, and heard a lot about resilience coming from rural communities and how they were responding to COVID, some of the social things that were happening to mitigate the impact of the community. We learned a lot from the survey and wanted to carry on with understanding a little bit more about rural community resilience as COVID-19 carried on. Some of the things that are underscoring the work we're currently doing is the idea that although rural communities are unique and distinct. There's an old adage we often say, if you've seen one rural community, you've seen one rural community. There are also patterns and commonalities that allow us to compare and contrast and thematically understand what's happening across rural BC. And that's what we set out to do. The other very important value that drives the work we do is the importance of citizen patient voices and the recognition that hearing and appreciating rural citizen patient voices is an essential part of understanding any rural phenomena like resilience.
Thanks very much, Jude. So when we first began this work funded by the SPORE BC Support Unit, there was certain funding that was set aside directly for the recruitment of a citizen advisory committee, specifically to guide all of our research activities. So the way that we went about this was by creating a poster advertising this opportunity, and we sent it out to 14 different rural communities all across BC. And we were very conscious to place this poster in areas that we thought might receive a lot of traction from different community members, including places like coffee shops, food banks, libraries, rec centers, and town halls. And our aim here was to really make sure that this opportunity was spread in a way so that plenty of people could hear about it, including those who might not be already connected with research networks. We're also lucky at the Center for Rural Health Research to have some communication channels with chambers of commerce and local media stations for about 92 different rural communities. So we also sent out an online version of this poster through those channels and asked them to distribute it throughout their own networks to just increase the visibility of this opportunity. And something else that we did in order to get the message out was to share this notice on Facebook pages that are associated with rural colleges in BC. And the reason for that is that we're hoping to share this opportunity with a younger demographic than who might often make up advisory committees. And something that we were very clear with on the poster was the commitment to pay members of the advisory committee $500 as a recognition of their time and their expertise throughout the project. And we feel this is very important, not only to respect the experience and the effort and the hours and the insights that the advisory committee brings to this project, but also to try and make this opportunity accessible to people of various socioeconomic backgrounds, time commitments, and ages. So really our overall intention with the recruitment process was to try and recruit participants from a variety of different geographies and ages and backgrounds to really represent the diversity that we see in rural BC. And before we hand it off to Soham and Eric to talk about their experiences, we thought it was really important to just make clear how instrumental the Citizen Advisory Committee has been in both determining project outcomes as well as the content of this research. For instance, members brought insights regarding rural community resilience that weren't found in the academic literature and that we wouldn't have been able to incorporate in our research without them. For instance, the themes of housing and reconciliation were noted as being hugely important, and they've made the way into the survey and helped enrich our survey for this local context. But we wouldn't have been able to do that without the input from our committee. And also the advisory committee worked tirelessly to really ensure that the survey instrument we produced was accessible, that it was easy to understand, and importantly, that it really reflected rural priorities.
Thank you, Claire. I'll be talking about how the Citizen Advisory Committee works. I'm situated in Dawson Creek, and I would like to start with how the committee started. So initially, terms of agreement was sent to all the members of the research team, which stated clearly about the scope of responsibilities and the expectations from the research team. From the members by the research team. Members were also provided an opportunity to add or edit anything to the terms of agreement, which would contribute to the efficiency of the research. So 90-minute meetings were held over Zoom every 2 weeks, and from September 2021 to March 2022, and there were 2 versions of the meetings to support diverse availabilities of the members of the research team. And nextly, before and after every meeting, agendas and supplementary materials were sent out to the members, and it consisted of presentation slides as well as notes. So it also helped to members who weren't able to attend the meeting due to certain reasons. And I have also benefited from that personally. We also utilized Microsoft Teams platform to share ideas or materials outside of the meeting hours. Moreover, an iterative process was used to develop a survey. The survey also proceeded to discussions which helped to determine research priorities, survey topics, and there were ways to refine the survey. Also, Claire and Jude were kind enough to include the input of members identifying other important issues in the communities which were before and after as well as during the COVID-19 pandemic. Thank you.
Hello, everyone. It is a great pleasure for me to be here today with Jude, Claire, and Soham. I'm a member of the Citizen Advisory Committee, and as a citizen of the community of Alert Bay, I would like to say a few words from my point of view on what we did, how it was accomplished, and what potential benefits our work may have for rural health. I was in our post office and saw a notice and applied to become a member of the committee and was delighted to be chosen by Jude. Just a few words about our area. Comes under the agency of Mount Waddington Regional Health District. It covers a vast area, 20,000 kilometers, extends to Kingcome, Broughton Archipelago, and other communities. These are the ancestral homes of the Kwakwala speaking nations and presently of the Nomgis and other First Nations. Alert Bay's medical center is run by the Nomgis First Nation, and it has a long history of service to all members of our community. The committee, under the guidance of Jude and Claire, quickly got started, and I was soon drawn in by the open nature of the process and the collaboration as we worked towards our goal of building a survey instrument that reflects rural citizen priorities. I was impressed how I, as a citizen, was able to contribute to the concept and the details of this public health project. I have high respect for Jude and Claire in how they achieved this through listening to our experiences and incorporating the input from the advisory committee. Public health is a topic that affects all of us. From the grassroots and as a patient and recipient of care, allow me a brief anecdote of the time I had to have surgery in Campbell River Hospital and how the nursing staff put me at the top of the list because I needed to get back up the road to Alert Bay. And I had to have someone who would be there as I was discharged. I would call that putting patients first. That someone I referred to was Gary, the driver for Wheels for Wellness. So Gary waited as I went in the OR at 12 noon and met me as I was discharged at 1. I also call that putting patients first. The surgeon came as I awoke from the hernia surgery and says, "Okay, Mr. Hunter, you're good to go. And please, because of the stitches, please don't laugh too much." I was not at that time feeling like laughing, but appreciated his good care and advice. I would like to add that my personal anecdote illustrates that ultimately, as citizens, we are all potentially clients of our system of care. Finally, I would like to say that as I speak, our project is approaching its end stages, and I have nothing but confidence that this will prove to be helpful for patients, not only for now, but into the future. I would like to say a big thank you to the conveners of Putting Patients First for allowing me to share with you today. Thank you very much.
A little while ago, we asked the members of our Citizen Advisory Committee if they could complete a short, anonymous survey talking about their experience in the committee and why they joined. And the motivations for joining varied. Some people felt that this was an opportunity to lead to improvements in healthcare, and this was something that they could help with. Some felt that there was a lack of resilience and a concurrent lack of citizen engagement and wanted to see the two come together. Some were very interested in sharing their own story or the story of their community, and some were interested in the research itself and wanted to be a part of that. When we asked them what works well about the Citizen Advisory Committee, a few different things came up, including a diversity of geographies and opinions that were included, as well as the very committed and motivated committee members who work to always push our project forward in a positive manner. The respectful atmosphere was something that came up a lot, as well as the various channels of communication and the opportunities to meet at different times in order to match different scheduling and availability issues. When we asked people what could be better about the Citizen Advisory Committee, there were some concerns about needing more diversity, particularly geographic diversity, and there were questions raised if the northern BC area was really as well represented as it could be. And when we asked people if they felt that if their contributions were heard, if their participation was meaningful, overwhelmingly the answer was yes. And the reasons citing for this included things like that they were able to get instant feedback during discussions, or that they were able to actually see how their contributions led to concrete changes in the survey itself, or that they received instant explanations as to how their input would be used. For example, what points of the survey would be changed based directly off of their input.
Other questions that we were really interested in were those around whether or not the contributions of the citizen panel would actually make a difference to community resilience in BC. And it was very clear that there was a lot of positive regard for the potential, but it's going to depend on getting the research out to appropriate policy and decision makers. I was particularly interested in the last question we asked, which was regards to if there was enough opportunities for citizen disengagement in healthcare planning in BC? And that question came out of a real personal interest based on my experience of the incredible contribution of our panel of 12 members and what they were able to contribute to our understanding of the phenomenon of resilience. Most said not really. There was local engagement for many at a community level, but in terms of actually affecting health service delivery change, not so much or not quite yet. And I think that speaks to the need for bridging the engagement with actual health services planning or policy implementation at some level. So we're going to leave it at that. We're very happy to take some questions, and thank you very much.